Welcome to the Tucson Unified School District Heat Stress and Heat Safety Program. The information in this training was prepared by the TUSD Risk Management Department. This course is designed to familiarize TUSD employees with heat stress, heat hazards, how to recognize heat-related injuries, and what actions to take. The course is also designed to provide best practices when performing duties in an environment where heat stress is a risk. After completing this training, you should be able to recognize common signs and symptoms of heat-related illnesses, identify hot working environments, point out heat stress and heat injury factors, implement heat stress prevention measures, discuss how to handle heat stress in emergency situations. To maintain a stable internal temperature, the body must get rid of excess heat. When the air temperature is close to or warmer than your body temperature, or when humidity makes it difficult for your body to sweat, it can become hazardous to your health. If there is prolonged exposure or strenuous activity at this level of heat, the potential for heat disorders increases. These disorders tend to start with mild fatigue or a heat rash, but can lead to fainting or collapse. There are many people who are exposed to heat on the job. Whether work is performed outdoors or in a hot indoor environment, overexposure to heat puts a person at risk for heat-related illnesses. But these illnesses are preventable. A person's best defense against heat-related illnesses is prevention. The most serious of the heat-related illnesses seen here is heat stroke. Heat stroke can cause death or permanent disability if emergency treatment is not given. The second most serious heat-related illness listed here is heat exhaustion, followed by heat cramps. Identifying hot working environments requires looking at the tasks involved with the job, as well as environment where the work will be performed. Jobs in landscaping, exterior maintenance, roofing, mail and delivery, warehouse, kitchens or cafeterias, and poorly ventilated spaces often require strenuous physical activity and/or exposure to heat sources. Some workers handle heat stress less effectively than others. Heat intolerance happens for a variety of reasons. Personal risk factors include age, weight, physical fitness, medical conditions like high blood pressure and heart disease, lower level of physical fitness, use of certain medications such as diuretics or water pills, or blood pressure medicines, alcohol or drug use. However, this list is not comprehensive. Other medical conditions can also predispose workers to heat-related illnesses. Environmental risk factors for heat illness means working conditions that create the possibility that heat illness could occur. Environmental factors can also affect a person's ability to handle the heat. This includes exposure to high temperature and humidity, direct sunlight, contact with hot objects, and areas with limited air movement. The National Oceanic and Atmospheric Administration, or NOAA, has heat alert procedures that are based mainly on the heat index. The heat index is a measure of how hot it really feels when relative humidity is factored in with the actual air temperature. To find the heat index temperature, look at the heat index chart shown here. As an example, if the air temperature is 96 degrees Fahrenheit and the relative humidity is 65%, then the heat index temperature will feel like 121 degrees Fahrenheit. The National Weather Service will initiate alert procedures when the heat index is expected to exceed 105 degrees to 110 degrees Fahrenheit, depending on local climate, for at least 2 consecutive days. Staying informed of the weather conditions before starting job tasks requiring strenuous physical activity and/or exposure to heat sources can also help in identifying a hot working environment. When the body is unable to cool itself through perspiration, serious heat illnesses can occur. The most extreme heat-induced illnesses are heat exhaustion and heat stroke. If not treated, severe heat-related illnesses can lead to mental confusion, seizures, or even death. It is important to recognize the common signs and symptoms of heat illness. Heat fatigue is extreme tiredness that is often due to a lack of acclimatization. Symptoms of fatigue include impaired performance of body movement and impaired mental performance. If you experience fatigue due to the heat, there is no treatment except to remove the heat stress before a more serious heat-related condition develops. Heat rash is a skin irritation caused by excessive sweating during hot, humid weather. It is the most common problem in hot work environments. Heat rash looks like a red cluster of pimples or small blisters. It is more likely to occur on the neck and upper chest, in the groin, under the breasts, and in the elbow creases. If you notice a heat rash beginning to form, try to work in a cooler, less humid environment when possible. Keep the affected area dry and use dusting powder to increase comfort. Heat collapse is a fainting episode or dizziness that usually occurs when prolonged standing or sudden rising from a sitting or lying position. In essence, the brain does not receive enough oxygen because the blood pools in the extremities, such as the hand or foot. Factors that may contribute to heat collapse include dehydration and lack of acclimatization. Symptoms of heat collapse include lightheadedness, dizziness, and fainting. To treat heat collapse, sit or lie down in a cool place when you begin to feel symptoms. Slowly drink water, clear juice, or a sports beverage to rehydrate. Regardless of which signs or symptoms you or your coworkers may be experiencing, it is important to be conscious of any change in behavior to avoid suffering from a heat-induced illness. Heat cramps or muscle cramps usually affect workers who sweat a lot during strenuous activity. These cramps are often caused by performing hard physical labor in a hot environment. This sweating depletes the body's salt and moisture levels. Low salt levels in muscles cause painful cramps. Heat cramps may also be a symptom of heat exhaustion. Symptoms of heat cramps include muscle pain or spasms, usually in the abdomen, arms, or legs. Stop all activity and sit in a cool place if you start to have heat cramps. Drink water, clear juice, or a sports beverage to rehydrate. Do not return to strenuous work for a few hours after the cramps subside because further exertion may lead to heat exhaustion or heat stroke. Heat exhaustion is the body's response to an excessive loss of water and salt, usually through excessive sweating. Workers most prone to heat exhaustion are those that are elderly, have high blood pressure, and those working in a hot environment. Symptoms of heat exhaustion include heavy sweating, extreme weakness or fatigue, dizziness and confusion, nausea, clammy and moist skin, pale or flushed complexion, muscle cramps, slightly elevated body temperature, and fast and shallow breathing. If you begin to experience heat exhaustion, rest in a cool, shaded, or air-conditioned area. Drink plenty of water or other cool, non-alcoholic beverages. If possible, take a cool shower, bath, or sponge bath, or apply cold compresses or ice packs. Seek medical help if symptoms worsen or do not improve within 60 minutes. Heat stroke is the most serious heat-related disorder and is caused by a combination of highly variable factors, making it difficult to predict. It occurs when the body becomes unable to control its temperature. The body's temperature rises rapidly, the sweating mechanism fails, and the body is unable to cool down. When heat stroke occurs, the body temperature can rise to 106 degrees Fahrenheit or higher within 10 to 15 minutes. Heat stroke can cause death or permanent disability if emergency treatment is not given. Symptoms of heat stroke include hot, dry skin or profuse sweating, hallucinations, chills, a throbbing headache, high body temperature, confusion or dizziness, and slurred speech. If you think you are experiencing heat stroke, call 911 or ask somebody to call 911 and help to move you into a cool, shaded area. Next, loosen clothing and remove outer clothing. Take a cool shower or apply ice packs or cold compresses. And have someone fan air on you and drink water. Knowing what to do when you or a coworker is showing signs of heat illness can mean the difference between life and death. Look for signs and symptoms of heat-related injuries and illnesses such as headaches, dizziness, and mental confusion, lightheadedness, or mood changes. Also look for weakness, stumbling, or cramping. If you see someone who seems to be succumbing to heat, the first step is to immediately report any signs or symptoms of a heat-induced illness. Then second, move the person to a cool, shaded area and don't leave the person unattended. Third, if the person is dizzy or lightheaded, lay them on their back and raise their feet a few inches. And next, loosen and remove heavy clothing or PPE, also called personal protective equipment, glasses, gloves, earplugs, etc. Next, if the person is sick to their stomach, lay them on their side. And finally, call 911 if necessary. Heat injuries are a life-threatening medical emergency and need to be treated immediately. Preventing heat stress is not just your responsibility. There are many things the district can do in order to balance the heat to prevent overexposure as well. Ventilation, air cooling, fans, shielding, and insulation are the 5 major types of engineering controls used to reduce heat stress in hot working environments. Clothing serves as a barrier between the skin and the environment to protect against chemical, physical, and biological agents. However, clothing will also alter the rate and amount of heat your skin can exchange with the air. One step you can take to protect yourself from heat stress is to wear light-colored, loose-fitting, breathable clothing such as cotton. Non-breathing synthetic clothing should be avoided. According to the National Institute for Occupational Safety and Health, or NIOSH, the thicker the clothing, due to layering or air impermeability, the more difficult it is for the body to exchange heat with the environment. Work practice reminders to aid in controlling heat exposures include: take frequent breaks in areas that are cooler and/or shaded, adapt to hot working environments over a period of days, pace your work or reduce physical demands during hotter times of the day, and drink cool, which is 50 to 60 degrees Fahrenheit water, or other cool liquids frequently, excluding alcoholic and caffeinated beverages. OSHA recommends 1 cup of water every 15 minutes. To prevent heat illness, remember these 3 simple words: hydrate, rest, shade. Taking these precautionary measures can mean the difference between life and death. Now that you have completed this training, you should be able to identify hot working environments, recognize common signs and symptoms related to heat illness, implement heat stress prevention measures, and discuss how to handle heat stress in emergency situations. Congratulations! You've completed the TUSD Heat Stress and Heat Safety program. Now, pass the quiz under topic number 2 to receive credit for this training. If you have any questions, please contact Risk Management at 520-225-6601 or email at riskmanagement@tusd1.org.